Second here, Carrie Mimmitz.
Awesome. Let's do roll call. My name is John Romano. I am a Board of Health member and our chairperson for today.
I am Carrie Mimmitz, a board member.
I'm Michael Thero, Health Director.
Awesome. So we have our meeting minutes from 5/29/24. Has everyone had a chance to take a peek at that? Awesome. Does anyone have any concerns or questions about those minutes?
No.
Awesome. So I will put forward a motion to approve those minutes. Can I get a second?
Second here, Carrie Mimmitz.
Awesome. Let's all vote. John Romano, aye.
Carrie Mimmitz, aye.
Excellent. The motion has passed. The minutes are approved. All right. So now, Michael, you wanted to go into public comment at this stage?
Yeah, so public comment period. So Donna, if you just want to do a little explanation of what you had planned on doing and what about your business there, that'd be great.
Sure. Can you hear me okay?
Yep.
I don't think I'm as practiced as you all are for doing Zooms, but that's okay. Thanks for having me tonight. I'm trying to open up a spa-like business. I think of it more as therapy than spa, but it can be easily called spa, with float tanks, halotherapy, red light therapy, and infrared saunas. These are all alternative wellness modalities. I don't know how much time you have this evening to go into detail or how much detail you want.
A brief description is good. I mean, we don't need a lot of detail. Like I said, we don't have any active regulations on this, so it's just kind of giving us the brief description of what it is and what it entails.
Okay. So floating is being in an enclosed, typically enclosed pod or a vessel of some sort, a tank, some refer to, with no lights, no sound, although those are options, but it's a sensory deprivation moment. The water is about 10 inches deep. It's skin temperature at 94 degrees, and it has about 1,000 pounds of Epsom salt in the tank. So it makes you very buoyant. The salt is antibacterial in itself. So that has a lot of, as far as cleanliness, the tanks stay relatively clean, but they do go through a filtering and UV process after each visit from a customer. So they go in and they float for an hour or two, anywhere in between there. They come out, they shower before they go in, they float, they come out and they shower again to get all the salt off their body. The halotherapy will be an active room, which means there is a halo generator that blows micronized salt particles into the air. And you just lay back, sit back. You can chat with friends or read a book, anything that's relaxing to you. Part of the whole atmosphere is to be relaxed, but it's also to get the benefits from inhaling the salt particles. It helps clean out your bronchial airways. It's great for cold, sinuses, respiratory tract things, as well as skin abnormalities like eczema or psoriasis. The infrared saunas are treatments to help with regenerating cells in your body. So it cleans out the toxins and metals in your body. The infrared light therapy kind of does the same thing, works on relaxing the muscles, getting in internally to heat the body and your core, and just helping regenerate new cells so you're healthier.
Gotcha. Well, thank you for the overview.
Sure.
I think in the interest of kind of fairness to everyone, for public comment, unless anyone has any questions, we can move along. Does that sound good to the board?
Yeah, I mean, I don't have any questions. I kind of just had her come to see if you guys had any questions you had. Like I said, Donna, we don't do any regulations on this now, but Certainly in the future, if we are looking at anything or if we want any clarification, I will certainly reach back out to you. And we can
Okay.
have more discussions on that.
Yeah.
But right now, I think it seems everybody is good.
Yeah, I know
Okay.
Northampton has similar kind of
Yes.
float spas, and so if we're ever curious about regulations that other cities have, I'd be curious if they have any that we could kind of model. But yeah, for now, I
Sure.
don't have any concerns.
So I appreciate
Okay.
you coming, Donna. Thank you for
All right.
giving
Yeah.
us a little description of that.
Sure.
Excellent.
Thanks for
Thanks,
your
Donna.
time. Yep.
All right, so I was gonna move on to the new business part. On the new business, I'm gonna move up the violations just so we can start with those first. I have the owner of Harper Store with me right now, so I'm gonna just go grab him so he can be on camera.
Hello.
So I'm just gonna give you the background. So this was the third violation. We are just, so the discussion is, permanent suspensions and then the discussion of when he wants to have his 30-day suspension held. So we have discretion on when he can do it. The board can, grant whenever they want to do the 30-day suspension, but we can't mess with the day. So it is still 30 days. It's just when we want to schedule it for him. And then like I said, the discussion on if you want to do a permanent license ban. So I'll let him talk first. Just introduce yourself.
Hi, I'm Bill Valboy on Harper's Store at 404 Coleraine Road in Greenfield. I've had the store 17 years. I've been in the retail business since I was 16 years old. Like I was saying to Michael, nobody's more embarrassed and upset about this than I am. This was an employee. There's no excuses. I'll start with that. I will say this, the first 2 times, I never knew about them. I'm not saying it didn't happen because they sent me a thing saying when they happened and how it happened. And I do believe it happened. I'm saying I was never notified or I wasn't given something. I'm not saying you didn't notify somebody. I have a feeling it was the same employee, if you look it up, may have been handed the paperwork and destroyed the paperwork, but that's just guessing. But that's here nor there because it happened. It did happen. It will not happen again. I'm carding everybody. I take great pride in doing the right thing and what I think is right for not just the store, the whole town.
Okay, so if you guys just want to have any discussion, if you have any questions of him or.
My question would be,
Sure.
how is that employee still, is still
No,
there or, okay.
no. But can I make and this is
Point.
beside the point, but a little suggestion. If we could offer some kind of training, it would be great. You know what I mean? Or give me the resources to, I don't know if they have online training or something to that effect. I'd be more than willing to pay for an employee to go. I do tell them, just card everybody, but sometimes in the heat, I don't know. I can't make an excuse for what happened. I can't.
So on that note about training, I am looking into doing some trainings. I have done it for other municipalities before. So the Tobacco Coalition will help me set up trainings and we can invite all the vendors and employees if they want to come and we can really delve into the regulations to make sure that everyone has a very good understanding of it.
Okay. I appreciate you coming. What's the kind of financial impact of tobacco sales on your business?
What's that? I'm sorry, what's your question?
Financial impact of the tobacco sales on your business, what would that be?
It would be impactful. It would be impactful. If I didn't think it was impactful, I wouldn't sell cigarettes. I mean, I will say this, I don't even, the vaping pens and all that other stuff. I never, ever got into that stuff. The only thing I sold was cigarettes because that's what people want. I mean, and it's Of course it's impacted. It is. I mean, it's not like it used to be. It's, it's obviously it's slowing down, but it's such an addictive drug that people smoke. Like I said, I've been there 17 years. And when I first got there, as cigarettes went up in price, everybody would say the same thing. That's it, I'm gonna quit smoking. That's it, I'm gonna quit smoking. And you know what? 17 years, very few of those people have quit smoking.
Yeah, certainly difficult behavior to
Very
change. I see the other side of it, as a doctor in our community for sure. So I think Carrie, when it comes to this kind of topic, of course, the 30-day ban is certainly happening. I know that I don't want to destroy local businesses. I really like the idea that you've been running the store for 17 years and, knowing that tobacco, I expect tobacco to be an important part of the, organization for you. I mean, that's I imagine it's a very significant income stream.
So,
Um,
okay, I don't mean to interrupt,
no,
but
go
just,
ahead.
just in that same train of thought, what people don't realize in a retail business or any convenience store, which is a small business, it's hard to get a customer. And you need to retain every customer you get, because once they stop coming to your store, and I tell my employees this, we got to give them a reason to come to our store. So it's not so much the cigarettes, it's the fact that they buy cigarettes, they buy a scratch ticket, maybe a soda. You know what I mean? And they can't buy cigarettes. They're gonna go to another store where they can. But that's neither here nor there. I mean, I'm not fighting anything. What happened, happened. You know what I mean? I apologize for it. I can give you my words. I'm gonna do everything in my power that it will never happen again.
Yeah, no, I really appreciate, the sentiment you're sharing with us. And, like I said, I don't want to destroy the local business. So I personally, smoking cigarettes with, younger folks is certainly a huge problem. I don't think, punishing excessively one store is the solution to that problem. I think we're always going to have problematic substances in society. I mean, it's just an unfortunate reality of ultimately just being humans. There's going to be the stuff that's around, and so I don't feel like destroying your livelihood is a fair punishment for an employee who maybe wasn't doing the right thing.
Thank you.
Okay.
That's just how I feel. Carrie, I don't know if you have any thoughts on the idea of a permanent ban, but I personally, I guess, would be against it.
Oh, I absolutely agree with you. I'm pro small business. I understand it sounds, I also appreciate everything you've told us. It clearly sounds like, you didn't know what was happening and now you plan to fix it. And I am leaning towards, I believe you. So I am with you, John. I don't want to do a permanent ban. I don't think that's necessary.
Great. So now I guess we need to schedule the 30-day ban.
Right.
Yeah, so I would just take a quick vote on the permanent ban.
Oh, yeah,
just
sorry.
saying that you don't
Oh,
want it.
yeah.
Yep. So I'll put to motion the motion to not enforce a permanent ban on Harper's store. Can I get a second?
And I second that. Carrie Mimmitz.
Great. John Romano, I vote aye to not enforce a permanent ban.
Okay, so now we can talk about when they kind of want to serve the suspension. So what were you looking at?
I mean, you tell me, but the summer's the busy time. So if we could get into the fall, September, October, it's only a month or two away. I don't know how you guys feel about that. You know what I mean?
My only input would be, within a couple months. I wouldn't want to push it off too far. That's all.
Yeah.
I
What
have.
if we start October 1st?
That'd be great. Because
I think
truthfully,
that's-
I want to put this behind me. You know what I mean? I don't want it hanging over me.
Yeah, October 1st to October 30th. I think, that's, like I said, not trying to cripple your business.
Okay.
And certainly gives you some time to plan around alternate
So,
revenue
quick
streams.
question,
for-
what does this entail? I mean, Do I have to remove all the
So you would,
cigarettes?
so you would
or
have
do
to
I
remove all
cover
the
them?
cigarettes from the areas where they can be purchased,
Okay.
that can be accessed by the public.
Right.
So back rooms, anything like that, they would need to be removed. I'm not gonna make you remove them all the way off site, but they need to be removed from areas where
understand.
people can see them, any visible displays, anything like that.
No, I fully understand that. Okay. Okay. All right, thank you.
I think that's it for Harper's.
Well, so,
Yep.
thank
Yeah.
you.
All right, thank you for your time.
Thank
And so
you.
do I have to do a
appreciate it.
vote for the 30
Do-
days, like when to start or no? Is
Yeah,
that
so
necessary?
I'll send a letter out. I'll
Okay.
send a letter out notifying, and the 30 days start October 1st.
Thank you.
All right, so next we have a Smokers Haven violation. Do we have anyone representing them?
Yes, it's me, Shahryar.
Okay. So yeah, if you just wanna, you have something to say, it looks like this was your second violation. So just any background,
Yeah.
any things you're gonna do to change it, that you want to share with us?
I was lucky that the letter I got, it was third violation. Then we tried to figure it out from the past, but it was second violation from Smoke Heaven, selling cigarette to the minor. And I already fired the employee like same day. And we already done our suspension period, and I think I gave them the check for $2,000. And it was the store totally depends on tobacco sales. Like for a week, it was like $300 per day. So I try my best. Right now I'm working on the POS system that whoever comes to show ID and we scan that ID, so it doesn't go through if it's underage. I'm trying that thing. That's the best solution, I think so, because we are a human. Employee, he did mistake. I have a video. The underage, she came in and he was talking with another employee. He was not paying attention, and he just sell her the cigarette. I have the total video of it, but it's very hard to handle this. So best solution is, so we logged our POS system and check the ID. If it's ID, it's underage, the transaction will not go through. That's what I'm working on right now.
Okay, I think that's helpful. I
That,
think
When do you
that's
think
the
you'll
only
have
way
that?
I think so. Because employee don't have a pain. He don't care. They don't care.
No, the employee doesn't have a stake in your business, so that's very true. And obviously having a system like that will benefit you more
Yeah.
than the employee. So
Yeah.
I think that's a good fix. At least you're doing something proactive to help
Yeah.
with it. Any of you have any questions for him?
When's the scanning system going to be functional and kind of up and running?
I was working on it right now. I have a Clover POS system, so they have an app in it. But right now it's working with the Juul, the Juul brand. We don't sell Juul, but it's only with the Juul. It's not showing me with the cigarettes or custom I can do. It's only specific with the Juul stuff, not with the cigarettes or tobacco bags or papers, whatever comes in the tobacco. So I'm gonna talk with them, give me some kind of app so I can customize it, especially for the tobacco and the cigarettes. So the only thing that transaction doesn't go through, the POS system should need my access to do it. No. So
Okay,
I think
so
that's the only way. Yeah.
you're working on that. Do you have any other things that you're gonna be doing in the store that can help? Maybe just carding everyone, maybe, anything
We
that you
do.
have any?
I took over the store in 2019. So there were like more than 6 compliance check and we passed it. More than 6 compliance check and we passed it. I was strict about it, but eventually that's unlucky. Like it was gonna 36 months, but I got ticket in 34 months. So it was gonna be 3 years. I tried my best and my employees tried their best, but I was unlucky. It happened like 2 months before. So it was second violation. So after
Okay.
2 months, it was gonna be first violation again. So we tried our best, but still we are a human being. Like I have a video, he's not paying attention at all. And plus he don't speak English and all that. But that's not the way, that's not the solution. I think the solution is that we logged our POS system and they should scan ID. If the ID is underage, transaction will not go through, and obviously he will not buy cigarettes.
Great.
I think that's
So
a good
again,
system.
Wait. So again, you just have no idea when the POS is going to be up and running, if you, like any timeline, sort of timeline? I know
Uh,
you're having some
Probably I will
calls.
be back. I will be back in next week. So I will talk with the Clover. If not, then I will change my POS system, which allows us to do it. That's what I can do. Right now, they have an app, but it only controls Juul. It doesn't control cigarettes or any customized tobacco, just the Juul. Suppose if somebody comes right now, asks for the Juul device, it will not go through until he shows ID, and the ID is underage. It will not go through right now.
Okay, so you're looking into trying to find it so it flags the other cigarettes.
Yes,
and
obviously,
everything
because that's too much loss. That's too much loss for like little mistake.
Okay, I mean, I know they're out there, so you can find them. Obviously, I've been in other stores that have them. So they're out
Mhm.
there. So I mean, as long as you keep looking, and so you're thinking
We
maybe,
have to do it. I
yeah,
have to
so
do it.
you're thinking within a month, next couple of weeks, you'll be
Yes,
getting close to that. Okay,
yes, for sure. Yeah.
so we have some kind of timeline on that. Do
Yeah.
either one of you have any other questions? He did pay his fine and serve his suspension already, so it's kind of just the forever ban. So that's kind of up to you guys if you want to vote on that and talk or have any other questions on that.
I don't have any other questions. What about you, John?
No, I don't have any, other questions either. And I think similar to our last case, I'm not in favor of permanent bans. For when this is an integral product to a
That's
business.
small businesses, like he said.
Um,
That's our sales totally depend on tobacco sales.
Yeah.
So for
I
a
know.
1 week, I checked it's like 250, 300. That's it. I can't even pay my utilities for that. For 1 week, it disturbed. So I have to do it. I have to do POS system. So
Okay.
Yeah.
I mean, at least you have a idea of what you need to do going forward. So if you guys just want to do a quick vote on that.
Yeah. So I'll put a motion to not enact a permanent ban on Smoke Haven's tobacco sales. Can I get a second?
Yes, Barry Mehmet's aye.
John Romano, I also vote to not enact a permanent ban.
thank you.
I appreciate you coming and giving us a little information. That was great. Thank
Yeah.
you.
Thank you so much. Guys. Take care.
All right, so next stuff we have on new business, I'll jump right into. So we have update on PHE inspector position and search for a new inspector. We have put out applications. So there are some applications on our website for the city. There's application in Indeed. And then we did get it out on Massachusetts Health Officers website as well to try to find some people that might have already been kind of in this industry. So we did get it out there as well. I did get some applications in. I'm looking to interview 2 people next week. So hopefully I can get on interviewing some people next week and start moving forward with that again. The next thing on the agenda was a relevant training for the update on the inspectors. So we did have people, Meg and our IT and some of the inspectors from the other towns did do the relevant training on the tablets. So they did get that training. So they should be good when they do get the tablets eventually and start going out in the field to use them. We might try to set up some more training for some people that missed it, or maybe some refreshers before it really goes live, but that is starting to move forward as well. The next update would be on the grant for the Google Workspace. Unfortunately, I was not able to get it in before the end of 24 budget. We just couldn't get them, so unfortunately in the budgets, the service or the item itself needs to be delivered before you hit July 1st. And we ran into this in the last week of June, trying to get all the approvals on it. And by the time we got it out to the company that was gonna do the work, they weren't gonna have it done by July 1st. So unfortunately, we just couldn't get that in before the budget ended. So we are looking to resubmit that now with the new budget. So we're hoping to get that resubmitted, get IT working on that, get it out to the vendor to create the space, and then we can have all the PHE group into their own Google Workspace group, which will be good. They can share everything, all the nurses can share everything, and that will all work out a lot better. That was the end of new business for now. So I'm just gonna quickly go over old business. Old business, we had 59 East Cleveland that we were working on with the hoarding grant through. So we did clear that out. The case has been closed. We did get the property into 80% compliance. So we got all his living area rooms cleaned. He does have like a back bedroom and some stuff in the basement that he's gonna have to work through in the future. But we did give it livable again. We got him a new couch that we actually personally went and bought him at Salvation Army. We got the cleaning crew was good. They cleaned everything. They cleaned the kitchen out. They did some painting to seal some wood surfaces and everything else. So he's in a much better spot now. So that was good that we got him back into there. The next one's food inspection update. We have been getting food inspections done. We're trying to go through our list. As you know, I haven't been here before, so I'm just trying to get places up to speed, places that haven't seen somebody maybe for a year or two, because they are on like a 6-month inspection cycle. So we're trying to get the people that haven't seen someone, maybe 1 or 2 years, possibly because of COVID, lack of staff, whatever reasons. So we are getting into those places and getting them back up to speed with the new regulations and getting them cleaned up and everything that needs to happen. The last thing I had was on the green burial update, but unfortunately I have not heard from him again. His worker did reach out to me, his hospice worker, but she hasn't heard from him either. I'll kind of keep putting it on the agenda to see if it pops up again. But right now I haven't heard back from him. Any questions on any of that?
None from me.
And here,
Okay. All right, so I am going to play the role of Megan today, doing public nurse activities because she is at the Cape. So I will go through what her little synopsis of what we have for what's been going on in the public health nursing programs between June 5th and July 15th. So this month, she assisted with updating Greenfield's tobacco regulations to align with the state guidelines, which is what we voted on the last meeting. She also worked with Meredith from the Tobacco Coalition, issuing the necessary paperwork to the tobacco vendors who sold to minors, which were 2 of the hearings that we just went through. She worked with Mary to get a new spreadsheet set up so the Board of Health could see tobacco violations, specifically selling to minors, in a concise manner. We completed all our camp inspections. She worked up all the Maven cases, including Salmonella, Group A strep, COVID, Hep C, pertussis, anaplasmosis, babesiosis, ambiasis, and influenza. So we had quite a few, couple little cases come through that she was working on in the last period. She completed her ServSafe Manager course to assist the PHE work plan. Spent a few hours with me and Nicole making sandwiches for our unhoused residents on the town common. We actually had a Subway restaurant that was doing a renovation and they couldn't get rid of they weren't going to have the renovation. They were hoping to have the renovation done within the time period to keep the food. But they weren't going to meet the 7-day period for the food. So they actually donated it all to us. And we went out to the town common and made sandwiches for whoever came out and wanted them. So that was a good little event for the afternoon. And then she handed out hygiene supplies, wound care kits, and Narcan. She taught our PHE nurse, Sarah, the Stop the Bleed course, so that now she can become a trainer for the PHE as well. She's still working on getting our health department enrolled in Medicare reimbursement. We're hoping to be approved before flu season. So we're working on that. a lot to try to just get that in before we do our flu clinics. We are seeing patients in the office for medical issues and COVID testing. And she bought supplies such as poise masks, toothbrushes, toothpaste, soap, chapsticks, bug spray, sunscreen, and brought some of that stuff to the senior center, and we purchased that with PHE grant funds for seniors in need. And we also have a lot of those supplies in the office to hand out to people that come by. We completed all the duties needed for the PHE grant and developed and submitted our work plan and our budget. Mentor to PHE nurses and our liaison between boards of health. And she's also studying to do the registered sanitarian exam. So we had a lot going on this month. But it was good. We got a lot done. And then now we're going to start our new budget. Hopefully we'll get a lot more done. And fortunately, I'm sad to see you two leaving, but I know it's a lot.
Yeah.
But it's okay. I'm happy everything you guys did, and I'm glad I was able to meet you and enjoyed working with you guys.
Nice to meet
Yeah.
you too.
So that's pretty much all I got for you.
Congrats. That's an awesome month. That's amazing. Definitely brings a smile on my face hearing all the great work you're able to accomplish in that short period of time. So yeah, congratulations on that.
Absolutely. And I have to give Megan a high five because she also brought a bunch of these same supplies to the high school for the students. And I have a whole area of education and like deodorant, toothbrushes, and our life skills class made little kits for the kids with toothbrushes and combs, all from Megan and the health department. So huge thank you for that. So she also can add that to this, this.
I will let her
busy
know.
month. Yeah, very much appreciated. Yeah. Okay.
Think we're all set then.
All right. So I will put forth a motion to adjourn the meeting.
I second that.
So I vote to adjourn.
All right, guys. It's nice seeing you. You have a lovely rest of your night.
You too.
All right. You as well. Take care.
Night.